Since the start of phase 1, the daily number of new cases has stabilized and declined somewhat from over 500 new cases a day in early June to 100 plus cases, 200 cases in the past week. Some days may be higher, some days lower. I think it's useful for me to try to explain the situation by breaking down the various components of this number and to explain what each of these numbers mean. The vast majority of the daily cases continue to be migrant workers residing in the dormitories. This number has also gradually declined over the last few weeks as we systematically clear the workers and the dormitories. There were some imported cases in recent days because of returning Singaporeans, PRs, work pass holders, and long-term pass holders from overseas. Upon arrival in Singapore, they had all been placed on stay-home notices, and we test all incoming travelers before the end of their SHN period to make sure they are free of infection before they are allowed to mingle within the community. Hence, the risk of transmission from this particular group of returning travelers is low. The number of community cases has also remained low overall at around 6 to 7% of total number of cases on average. However, the number of community cases in the last few days has increased somewhat. In the past week, we have seen an average of 12 new community cases a day, up from around 8 cases a day. We therefore conducted a deeper investigation into these community cases to better understand the nature and the trends. Among the community cases, over half since the start of phase 1 are linked. The majority were detected through contact tracing, including household members or close contacts. Most had already been quarantined to prevent transmission. Once isolated, they pose very low risk of transmission to others in the community. These are the linked cases. Now, among the community unlinked cases, the majority were asymptomatic and they were detected via proactive screening of workers when we prepare them to work, or the regular testing of workers as part of our surveillance. Almost half are likely to be past infections because they were all tested serology positive. So once you test positive for serology, the implication is that they are likely to be past infections and they are no longer infectious. In fact, about half of the community unlinked cases have been workers from the construction sector or construction-related occupations, such as project management. Of these, about 2/3 are likely past infections. Minister Lawrence Wong will talk more about the construction sector later on. What is of greater concern to us are the number of symptomatic unlinked cases. Let me repeat that. What is of greater concern to us are the number of symptomatic unlinked cases that are detected in the community through routine screening for acute respiratory infection, or what we call ARIs. These are cases that emerge in the community with no clear connection to any existing cluster, dormitories, or construction sector. They reflect cases with unknown sources of infection. And if this number goes up significantly, we should be very careful as they may signal an increase in the underlying community transmission. So to allow us to detect infected individuals early and to quickly contain potential further spread, especially as we open up in phase 2, we expanded our community testing to all individuals aged 13 and above who are diagnosed with ARI at first presentation to a doctor, rather than to wait for prolonged ARI of 4 or 5 days. This allows us to detect infected individuals early and to quickly contain further spread by putting them under quarantine or send them for treatment in isolation. With this expansion of testing for those all individuals aged 13 and above, we do expect the numbers detected to rise simply because we are now testing more rigorously, even if there's no change in the underlying community transmission. But this will help us set a baseline for us to monitor the landscape, the situation better. So far, since phase 1, the number of unlinked cases detected through our ARI swabs has remained stable, but these are still early days yet, and we should watch carefully whether there is an uptrend, and if that is so, and whether the uptrend is sustained, and if so, then we need to be very careful to look out for community transmissions. I should emphasize that it has been slightly more than just 2 weeks since phase 2 started. Economic activities and social interaction has increased significantly. And taking into account the virus incubation period, we should expect the number of community cases, especially those detected through enhanced ARI testing, to start to go up over the next few weeks. We must therefore remain vigilant. The task force has adopted a cautious and proactive stance. Once we see a possible cluster forming, we will move in quickly to impose precautionary measures to break the chain of transmission, such as what we have done for the selected households at Block 111, Tampines Street 11, even though their risk of infection was assessed by the public health experts to be low. In total, 118 residents and visitors have been tested so far, and all results have come back negative for COVID-19. MOH will continue to closely monitor the situation. I want to take this opportunity to thank the residents of the affected households for their cooperation and for all the efforts that Singaporeans have put in to keep our homes, to keep one another safe. But I'm also concerned that we must continue to remain vigilant, because if we let our guards down, the virus will creep in, infections will grow, and we will have a bigger problem in our hands. Therefore, we advise the public to remain on your guards. Do abide by the spirit of the rule to limit social gatherings to no more than 5 persons, and continue to maintain a high level of personal hygiene and civic consciousness. We can prevent a second wave if we are vigilant and work with one another to keep infections low. This way, we can continue with our daily activities while keeping infection under control. Thank you. I'll ask DMS Professor Kenneth Mark to give a quick update on today's situation.
Thank you very much, Minister. As of the 7th of July 2020, the Ministry of Health has preliminarily confirmed an additional 157 cases of COVID-19 infection in Singapore. The vast majority still come from work permit holders residing in foreign worker dormitories. Based on our investigation so far, there are 20 cases in the community. 12 are Singaporeans or permanent residents, and 8 are work pass holders. From our information so far, of these 20 cases, 12 were close contacts of previous cases and had already been in quarantine. Epidemiological investigations continue for the other cases. We have 3 imported cases to report today, all of whom were placed on a stay-home notice after their arrival in Singapore, and there's not been any further contact with other people in the community as far as these 3 cases were concerned. We're still working through the details of these cases, and further updates will be provided this evening via the MOH press release that will come out then. Thank you.
Good evening. I will provide a little bit more of an elaboration on the infection situation, focusing mainly on the community cases that we have seen after the circuit breaker, in other words, since the start of reopening. As you heard just now from Minister Gan, if you look at the picture of community cases from phase 1 onwards, about 57% of them are linked, and the remaining 43% are unlinked. So about 60-40, linked versus unlinked. Amongst the unlinked cases, half are in the construction and construction-related activities. The vast majority of these cases were identified through our active surveillance. In other words, our proactive testing and periodic testing of construction workers every 14 days. It's because we have put in place this regime, and that's why we are able to identify these workers and pick them up. And about two-thirds of them have tested positive on serology, which means that they are older infections, not recent ones. This is not surprising in a way, because we have just come off a period where we have had very high incidence of infection in the entire construction industry. And we are systematically clearing the workers in the dormitories. We are clearing, we have suspended construction activities for quite some time, and then only now starting to resume some of these activities. So it's, in a way, we are now picking up some of these older infections as we go about the periodic testing of the workers. But the fact that there is such a continued high incidence of positive COVID results amongst these construction workers, I think remind us of the need to stay vigilant for this sector, extremely vigilant. And that's why we have to do two things. First, we have to be very rigorous in the way we go about clearing the dormitories. It takes time to do this, and we hear from time to time contractors asking us to just release the workers, insisting that it's okay. But we have to take the extra precautions to make sure that the clearance is done rigorously before we can allow these workers to go back to work. The second precaution we have to take is to make sure that the contractors themselves put in place new management practices. So it's not just about the workers being cleared, but also that the contractors put in place new safe management practices. Because of the nature of construction activities, it is high touch, high interaction. Very often, workers from all over, different areas, and sometimes not just the builders themselves, even architects, engineers, foremen, all coming together, interacting closely on the work site or in enclosed spaces. And that sort of a nature of the industry makes it a higher risk, and that's why it's important for contractors to have all the safe management practices in place, split team arrangements, and then housing arrangements for the workers before work can resume. And again, we have been engaging the industry very closely. We know it's quite a lot of things have to be done, and a lot of new requirements are put in place, and we have been engaging the industry closely and providing additional support to the contractors as well in order for them to get ready for the restart and the resumption of construction activities. So that's on the unlinked side, right? I said about 60-40, 40% unlinked, and then about half in construction. On the linked, on the side of the linked cases in the community, we know that the vast majority of them are cases transmitted through households. That's not surprising because, again, we now know that the nature of the virus is such that it spreads very closely. Very quickly with close contacts. And if you are living together in a household, it is very, very hard to prevent the virus from spreading to your household members. But what's interesting is also to see the patterns of transmission beyond the household. There are some infections taking place also in workplaces. And that's one area where all of us can do our part to reduce the risk of transmission further. Businesses, companies, employers all have to step up their safe management practices at work in order to further reduce the risk of transmission at workplaces. Making sure that the majority of their employees continue to work from home is one precaution that every employer should continue to take. Beyond that, for those who have to be in the office, having split teams, making sure they do not gather together for social activities, these are important precautions that every employer should continue to uphold. Thirdly, finally, for the linked cases, we've also found that there are very few of them that are happening through social gatherings. Very, very few of these linked cases in the community take place through social interactions. That's quite different from the pattern before the circuit breaker was imposed. Remember, at that time, we highlighted that a lot of the transmission was happening because of social gatherings. This was pre-circuit breaker. Today, this pattern is not seen in the transmission or in the infection numbers. And that's firstly because we have now imposed very tight restrictions on social activities. Right? We are not allowing for large gatherings, events, dinners. We still put in place a lot of restrictions. So the restrictions are helping, but at the same time, we should not be complacent, right? Because I think all of us, many of us, certainly would like to see these restrictions being relaxed over time so that we can engage in more activities. But if we want to do that, then all of us, again, need to be responsible, be vigilant, and do our part to avoid infections from picking up in these social settings. So the picture on the social side is positive. We are not seeing transmission happening through social interactions, but it's also a reminder for us that we cannot take this for granted. The numbers are low partly because of today's restrictions, and if we want to be able to progressively relax some of these restrictions over time, we do need to step up our own individual actions to take responsibility for our actions and to ensure that all of us do our part to minimize the spread of the virus. So that's the overall picture that we are seeing today in terms of the community spread, both linked and unlinked cases. We are continuing to monitor this situation very closely. We are stepping up and scaling up testing and tracing to the maximum extent that we can. And with all of these measures in place, we certainly will try our very best to continue to control the infection as we proceed through the coming weeks in the phase 2 of this reopening. Thank you.
Now I'll invite questions from the media.
Thank you, panelists. We'll now begin with the question and answer session. Members of the media, please remember to use the raise hand function if you'd like to ask a question. Please only ask one question to allow more to participate in the Q&A. May we have the first question from Timothy from Straits Times, please?
Thank you, Ministers. DMS, I'd like to ask what your assessment of the rise in community cases is. Are we seeing a second wave, and should we expect a retightening of measures given that this rise has occurred in spite of measures already in place and constant reminders to the public to be vigilant and responsible? Thank you.
Thank you. Maybe ask DMS to give his comments first.
We don't see this as a second wave at this point in time, but we are mindful that even during the circuit breaker and phase 1, phase 2 measures, there was a very low level of cryptic infections occurring within the community. As we've moved out from phase 2, and as we have more people coming together in close proximity, having more interactions together, that risk of transmission now increases. And therefore, the increased number of cases we're seeing in the community reflects that increased social interactivity leading to more transmission occurring. But that's not necessarily a second wave. Certainly, we are mindful. We continue to watch vigilantly for importation of cases, for cases coming from other countries back into Singapore. We have picked up, as you know, several travelers coming back. Most were asymptomatic, but found to have an infection during testing at the end of their stay-home notice period. And it was because of their isolation during the SHN period that we have safeguarded the risk of exposure to other people in the community as these travelers come back. So at this point in time, we're not seeing a second wave, but we think these are a continuing of some cryptic infections occurring within the community during this period of time, which has increased in numbers over the last few weeks as we moved out into phase 2 and now having more interactions occurring. It behoves me, therefore, to encourage all in the community to continue to practice safe distancing, to only visit seniors if it's necessary, to work from home. And these are the measures that continue to be relevant at this time to reduce that risk of infection spread in the community.
Thank you. I just wanted to add that currently, while we're not seeing a second wave yet, the risk is always there. So we have to continue to be vigilant. To be honest, when we saw the cluster in Tampines Street, I was very concerned that this could be a major outbreak for us because we have quite a number of cases within one household, and then it has some connection to the second household. We have not been able to establish conclusively what's the connection between the two, but there is a suspicion that there would have been some connection between the two clusters. And there is also a risk that you could have a third cluster popping up from the Tampines group of households, and you could have a spread to other settings beyond just the households arising from this group, and then you have a potentially a significant cluster in our hands. And that is why we decided to go beyond the usual public health SOP, and we decided to test everyone on that section of the building to give us an assurance that there is no other further transmission beyond these particular two households. And so far, the results are negative. You could well imagine that a third or a fourth household may be affected, or a household in another block could have been affected, and someone who is connected to them in somewhere else in the workplace may have been infected. Then you have a potentially explosive situation. And in many of these scenarios, especially in the second wave type of scenario, you are also expecting to see potentially some super spreading events, like what we have seen in the Safra cluster, for example. Because of a small group of number of people being infected, it suddenly becomes quite an extensive group. And that actually will bring forth potentially a second wave. Because with the sheer number of people being infected at the same time, then the risk of further infection will increase quite significantly. So these are the signs that we will be monitoring. And every time when we see potential risk, signs of risk of second wave, we try to move fast and move aggressively and do more than what is usually the standard practice, and as illustrated in the Tampines cluster efforts.
Thank you, panelists. Can we have the next question from Matthew Mohan from Channel News Asia Digital?
Hi, I had a question for Minister Lawrence. So I think earlier you mentioned an observation where you said that for the community-linked infections, that you noticed that there were some that were taking place in the workplace. I wanted to ask, can we confirm that since the circuit breaker, there's been an increase in terms of this proportion? And if so, does it point to the fact that employers need to take it more seriously and need to do more?
So certainly since the circuit breaker from the start of phase 1, we have had more community cases. And as I said, the majority are household transmissions in the household setting, but there are a few that are transmissions in the workplace settings. So certainly, it's not many. It's not that we have not seen large clusters at the workplace settings, but certainly the few that we have seen are a cause for us to, or should remind all of us, and all employers in particular, that they really need to take safe management practices very seriously, which is what I had reminded everyone just now. So firstly, as I said, continue the call for all employers to have their staff work from home remains till today. Right? We have not changed that stance. Anecdotally, I hear some people saying that their bosses are now asking them to go back to work. Well, that should not be the case. Employers should still have their staff work from home, and they should only come back to the office to work if there is a clear and demonstrable need to do so because the employees need to use some specialized equipment or some machinery at work, right? So that condition remains, and I think that's one precaution that all employers can take so that even if there is an infection happening in the workplace, it will not cause a large cluster because the number of, the transmission will be limited. The other precaution, as I highlighted, is that within the office setting, employers should make sure safe distancing and safe management practices are upheld. It's in the way the staff, employees are seated, but very often it's also in the kinds of informal activities that happen in the workplace, like in the pantry, in the office canteen, where people tend to let their guard down. And so all employers really need to keep close watch over these sorts of different settings in their office or work premises and constantly remind their employees to take these precautions. And as we've said before, it's in the interest of the employers to do so, because should a cluster form in the workplace, we may very well have to ask the employer to close their business operation, shut down their business operations temporarily, and then require every employee to be tested. And this will only impact the business. So better for the employer, for the business operator, to take this seriously and put in place all the necessary precautions and measures.
Thank you, Minister Wong. Can we have the next question from Pei Yin from Liang He Chapao?
Good afternoon, Ministers and DMS. This is Pei Yin from Chapao. My question is regarding Professor Tambaya's view that the MOM should take responsibility for the previous outbreak of cases, even though the advisory is backed by doctors. And the opposition party has also defended that they have similarly put up proposals to deal with the pandemic. Can we have the minister's comments on this, please? Thank you.
I would suggest that since the MOM advisory, as we have said, is not just an advisory issued by MOM alone, but specifically with medical advice, I think I'll let Professor Kenneth Mark make the comments on this particular question.
Thank you very much, Minister. Just to clarify, when the Ministry of Manpower issued the advisories, it actually issued the advisories because Ministry of Health asked Ministry of Manpower to intervene and engage the employers. So it wasn't a set of advisories that Ministry of Manpower initiated on their own and did this without, in fact, any engagement at all. This was something that came at the request of the Ministry of Health. The context was something that we had explained over the weekend. We had received feedback from the hospitals. In fact, they were very concerned. I remember one of the chief executives from one of the hospitals calling me on the 8th of February to complain about how supervisors were bringing the employees and workers to the A&E department to be tested. They were well asymptomatic, and basically the supervisors were demanding for certificates and memos to be issued to these workers to deem them free from COVID infection so that they can then be allowed to go back to work. And they raised a lot of alarm bells among the senior management in the hospitals because, one, they could not issue such a memo in good faith. A single negative PCR test would not be able to confirm that any worker was free from infection at all. Secondly, they were very busy in the A&E departments. This was also a period of time when we had expanded our case definitions. There were more people coming to be screened with symptoms for COVID infection. And now to have a group of asymptomatic and well workers coming in would distract them away from attending to more sick and ill patients. So these were concerns that were fed back. We guided both the A&E departments and doctors on scene and asked that the Ministry of Manpower convey the same feedback back to the employers, that if there was any concern about the state of health of their workers, then the more appropriate place where these workers should be going to would be the general practitioner or family physicians, where they could do a proper assessment and make a decision, therefore, whether they indeed really required hospital care or even be tested. Therefore, they could receive the appropriate care accordingly, rather than to bring these workers straight to the A&E, cause more congestion within the A&E, yet at the same time prevent the A&E from actually seeing more ill patients and attending to them. So it was in that spirit that the Ministry of Health asked the Ministry of Manpower to help us, and the Ministry of Manpower then accommodated our request by issuing that first circular, basically conveying these same sentiments, that it's not possible for the hospitals to issue a memo certifying that their workers were free from infection. This should not be a reason to deny them the opportunity to go back to work in the workplace. And if there was any concern about the state of health for their workers, the more appropriate place would be then to send them to the GP, not to the A&E department. The circular was sent out, and I understand nearly a week later, a second advisory was sent out because there were employers that still persisted in sending their workers to the A&E, despite the original set of advice they'd been given. And I think it was the second advisory that was a little bit more strongly worded, which has become a topic of contention. But it was because of a few, a few employers that were persisting in sending their workers despite the original MOM advisory. And therefore, MOM then issued a much more strongly worded directive. The original directive, in fact, tried to provide the reason and advise employers to do the right thing.
Thank you. Can we have the next question from Fatin from Reuters, please?
My question is to Minister Lawrence Wong. How do you think the voters will assess Singapore's COVID-19 task force performance in the upcoming elections? Do you think that your performance will work in PAP's favour?
Well, at the end of the day, Singaporeans will have to judge. We are in election campaign now. We have been transparent, upfront with Singaporeans about the way we have dealt with COVID-19. We have been meeting the media every week. Even now, during the campaign, we have continued to meet regularly and to deal with the situation as best as we can. And if you look at what we have achieved up to now, well, the outcomes are quite clear. We have been able to bring down infection rates in the community significantly and protected many Singaporeans, especially the vulnerable ones. And we have been able to achieve a fatality rate which is amongst the lowest in the world. Where the cases in the dormitories are concerned, we have mounted a huge effort. I do not know of any other country that has mounted as significant an operations as Singapore has in taking care of their migrant workers. We have moved in swiftly. We are in the process of testing all the workers. As I've said, it's more than 50% done. We will be almost entirely completed by the end of this month, maybe slightly beyond that. We have not only taken care of the health of the workers, we have also taken care of their well-being, their food, their salaries, making sure that they are paid. So we have done everything we can to ensure the overall well-being of these workers, because we know that they are an important part of our society, and we want to do everything we can to take care of them because they have contributed much to Singapore. So whether it's community infections, fatality rates, or migrant workers, these are the facts. This is what we have done over the last 6 months, working continuously with thousands and thousands of frontliners who have also put in tireless contributions and sacrifices to this COVID-19 operations. And as we've said, this fight is not over, it's continuing, it's far from over. There's still so much that we need to do, and that's why we have asked for everyone to focus their minds on what is critical during this crisis period, because we do need to continue to stay united in order to manage the rest of the outbreak, in order to overcome and defeat COVID-19 together.
Thank you, Minister Wong. Can we have the next question from Tessa from Today?
Good evening, Ministers and DMS. My question is on the unlinked cases. I was wondering, since it was said that there's a big proportion of them that are still unlinked, is there a concern that there's this well of unlinked cases that exist that we don't know, or cryptic cases that exist in the community that we are not aware of, that would be a concern about in terms of community transmission? Thank you.
If you look at the unlinked cases, as we explained, about half of them are in the construction or construction-related activities. And in a way, that's many of them too, amongst this group, are older infections. So they are, in a way, we are picking up some of the residual, if you will, from the earlier high incidence of infection that we had in the construction industry. So I think that group, it's not something we need to be overly concerned about, because these are older infections, but it's good that we are picking them up anyway through our active surveillance regime that we have put in place now for these workers. Construction, marine process, we are testing them on a periodic basis. The rest of the unlinked cases that we do worry about and we watch very carefully are the ones that we pick up from the ARI, the acute respiratory infections, those that are reporting sick to the doctor, and then we test them, and then if we pick them up, that's the ones that are, you don't know where they are from, they are just reporting sick, and then when you test, if it's positive, you know that these are cryptic infections taking place in the community. That's something to worry about, but that number has not gone up, right? So that number is low currently, and we are, as we have explained, expanding the scope of testing too, so that it's not just prolonged ARI. We are now testing all ARI at first presentation to the system when they first see a doctor, and we are doing it for everyone who is 13 years and above. Right? So with this expanded scope of testing, we hope that we can pick up these cryptic cases faster and then potentially isolate, ring-fence them so that we do not see further outbreaks from these cases.
Maybe I can just elaborate a little bit more. If you look at the cases that community cases that we are seeing now, they are basically linked and unlinked. Those cases, they are linked. We know where the sources are, so we are more assured that we are able to ring-fence them, contain them through quarantine and so on. So those are better managed and of less concern to us. The unlinked cases, as we have said repeatedly, are those that are of more concern, because we don't know where the infection came from, and therefore there's likely to have other infections that are going on that we are not detected because they're unlinked. And for those unlinked cases, as Minister Wong mentioned, a significant number of them are actually related to construction or construction-related activities. And in a way, we know roughly where it came from, although we may not be able to pinpoint exactly who's the source, but we know because of the environment that they work, they are likely to have been infected from that kind of activities. And so there's also some greater assurance that the sources are known, defined. And it is the unlinked cases that are not related to construction, and we are not sure where they came from. And these unlinked cases are likely to have multiple sources. One of them are through the proactive testing. And these proactive testing, a majority of them were old cases, and they are asymptomatic. When they're asymptomatic, in most places, when you don't do this type of a proactive testing that we do, you probably will never pick them up, and they just went unnoticed. We pick them up because we do all these proactive testing, and in fact, the fact that we pick up quite a number of them is an assurance that we are picking up quite proactively. So a large number of them are old cases because they are tested serology positive, and some of them are active cases, but because we are picking them up through active testing. And what is beyond our control are those unlinked cases that are symptomatic. They would have been picked up sooner or later, and that is why we are expanding our testing through the ARIs to pick up symptomatic cases as early as possible. These are the cases, they are in the community, that will be picked up, and they are symptomatic, they are likely to spread, and therefore we need to be able to identify them, ring-fence them as quickly as possible, and that is why we have expanded the testing of ARI cases. And as we expanded the testing scope, we are likely to pick up more and pick up earlier.
To extend on the Minister's point as well, what is important in relation to the unlinked cases is how we respond to them as we pick them up. So what is critical is that as we pick these up, we get these positive test results, we quickly bring them into isolation so that there's no further risk of exposing other people once we've picked up and diagnosed these cases. And then we draw a ring fence, isolate all close contacts as quickly as is possible as well. For all those that are picked up, for example, through a regular routine testing, as soon as we get the test results, we've been working on our workflows and our processes to get those positive test results to us as quickly as possible. And our commitment, therefore, is once we pick up these positive cases, to get them isolated within 24 hours, within that working day, if possible. And once we can do so, we now also disrupt that chain of further transmission that takes place because we have successfully isolated them as quickly as possible. Then we cast a net and ring quickly around all close contacts. And we endeavor to do serving, we are able to serve even electronic quarantine orders through messaging, even within a few hours of getting that positive test result to us, and then following through such that within the next day or two, we are able then, if necessary, to serve even physical quarantine orders to those other close contacts so as to bring them out of circulation, keep them isolated, prevent any further chains of transmission. And the testament to that is, in fact, the number of cases now we're picking up of people who are in quarantine. That means our net has been cast, the net is sufficiently wide, there's no further risk to the community. So these are things that we're working on. It's not just an ability to expand our testing regime. What's important is our responses after we get a positive test. Bring these people quickly out of circulation, disrupting chains of transmission, and this is what we're working on to deal with these unlinked cases as well.
Thank you, panelists. Can we have the next question from Jonathan from Tamil Morasu, please?
Okay, my question concerns the percentage of construction work sites. Around how many work sites have resumed work, and is there any order within this construction industry in which these different workplaces resume, perhaps according to where they are located, whether are they near residential areas or the density of workers within the spaces of work? So is there any order to that? And also, percentage-wise, perhaps, how many workers from these dorms have resumed work at their work sites? Thank you.
There is no specific order that we impose for the resumption of construction activities. The key criteria is that, firstly, the contractor must put in place all the safe management practices that we have already stipulated, whether it's for housing, transportation, or work sites. Second, the worker themselves must have been tested and cleared, meaning either they are recovered workers or they have not been infected before, but they have gone through that rigorous clearance process which we have described before, where they go through tests, not just once but twice, isolated and then cleared and assessed to be free from the infection. So when these two conditions are in place, the contractor is able to resume activities regardless of the location of their projects. As to how many workers in the dormitories are already resuming work, I don't have the latest figures, but as we had described previously, there were about 120, maybe now it's increased to 130, 140,000 workers who are cleared, and then about 90,000 who have resumed, of which 90,000 have resumed work. And that's because not all of the workers who are cleared have resumed work because, as I said, the contractors need to meet two conditions. It's not just the workers that are cleared, but also the fact that the contractors themselves need to have all the safe management practices put in place. So over time, as more workers are tested and cleared, and as more contractors meet the conditions, we do expect these numbers to go up, particularly by the end of the month, July. We think that up to 80% of workers in the dormitories would be cleared, and we do expect more contractors to progressively meet the requirements for them to resume activities.
Thank you, Minister Wong. Can we have the next question from Leila from Business Times?
Thank you. My question is, at what threshold, at what level of community infection would it be considered a strain to our healthcare infrastructure? And would task force consider moving us back to phase 1 or even the circuit breaker?
Well, let me explain that it's not a single number that we look at. In terms of the number of cases, also, because it also depends on the severity of the cases. From the previous experience that we have seen over the last 3-4 months, we can see that the vast majority of the cases are very mild, and the need for hospital care and the need for critical care, ICU facilities, is actually quite limited, as the vast majority of the patients are actually quite young, and they generally are well, and we just have to monitor them and isolate them to prevent further transmission, further infection, and they generally recover on their own. And we have also, over the last few months, developed additional healthcare facilities, including the community care facilities and community recovery facilities. And now we have also introduced community care facilities, CCFs, in the dormitories, so that some of them don't even need to go out and to be admitted into the external CCFs. They can actually monitored and recovered within the dormitory CCF itself. So I think over the last few months, we have actually expanded the capacity, not just in terms of the number of beds, but in terms of the range of facilities that we are able to cater to the varying needs of these patients. So I think we have capacity to deal with potential surge. But I always say that we cannot take our capacity for granted, because beyond the capacity, it is also the manpower. Our workforce, our healthcare workers are very stretched, even at this today's rate, because all of them work very hard overnight, tirelessly. So I think they need some breathing space. They do need a break. So we do want to make sure that we are able to sustain the healthcare system and healthcare workforce for the long term. Bearing in mind that because of COVID-19 over the last few months, we have deferred some of the healthcare services. They may not be urgent. Some of the chronic disease management, we may have deferred some of the reviews. Some of the elective surgeries may have been deferred. And now that the number of cases have stabilized and come down somewhat, some of these healthcare services will have to be restored. We need to continue with our, what we call the business as usual healthcare services, look after our other non-COVID-19 patients to meet their healthcare needs on an ongoing basis. So we are using this period when the number of cases are low to restore some of these services to take care of our other non-COVID-19 patients. But because the COVID-19 is still in our community, therefore the hospitals, healthcare systems is ready to ramp up the capacity once again when the need arises. So we have put aside some capacity reserved for COVID-19, and that's capacity for us to ramp up when the situation calls for it. But in the meantime, we need to also return to some of these routine medical services to take care of our patients. And therefore, I think we should never take for granted that our healthcare capacity is always there. We should always be careful, and we should always do our best to minimize community transmission. Because from experience, we have also seen that the number of cases, the increase in the number of cases can be quite exponential. And they can double the number every few days, every week, and therefore we always have to be vigilant and minimize the risk of transmission. As DMS has anything to add?
Yeah, just correct. We've had a lot of work done to increase our capacity to manage COVID-19 patients, both in our hospitals, which includes doing conversion works to create more isolation wards and ICU beds. We've also raised many community care facilities, as Minister has alluded to. And at this time, when we see the numbers of COVID cases overall coming down, we've had the ability also to repurpose some of the wards that we had put on standby for COVID-19 now to also support the resumption of healthcare services, the rest of regular healthcare services, supporting the rest of the community as well. We've also relooked at the community care facilities we have, and some of the facilities may not need to be operationalized at this point in time. We will keep them in reserve or repurpose some of them to support the ongoing dorm clearance strategies to facilitate the work that's being done there. So this work continues on. We retain that ability to search and to raise up more beds as needed. But at this time, on the basis of the existing COVID-19 cases, our healthcare infrastructure and services are not taxed, and we're able to handle the load as it comes. We are mindful also of the ongoing needs of our population, both in the chronic illnesses they have. We're keeping a close watch on dengue, which remains at a high at this point in time. And we are mindful that in other countries, they are looking very seriously at managing outbreaks beyond COVID-19, whether it's H1N1, influenza, or otherwise. And we are keeping an eye on all these. If certainly any of those other cases now come into Singapore, then that will increase the demand for healthcare infrastructure and services. And therefore, we are keeping a close watch to make sure that the services that we have, the capacity we have, remains nimble enough to adjust to the demands as they come. There's been some talk, I understand, in the social media about how after elections we're going to clamp down and go back down to phase one, we'll lock down again. And indeed, at this point in time, we continue to keep a close watch on the community, but we don't have actively plans to say that immediately after the elections we're going to quickly go back into phase one. That's not the case. But we are working on our contingencies. We are mindful that we may see clusters emerging in various places. We do not want to be complacent, and as a result, we are working on our responses should any of these scenarios bear fruit. So it's always important for us to be prepared for the worst, to be happy if that doesn't occur, to be prepared for these contingencies, but we don't want to overreact. At this point in time, we continue to allow for a safe resumption of services in the community, but that requires all of us in the community to do our part, to maintain our discipline, to actively practice safe distancing measures, to protect each and every one of us.
Can I just add one very quick point that, we certainly cannot rule out having to impose additional restrictions or even to have to, put in place another nationwide circuit breaker down the road. No one can rule out that possibility. Countries that have exited from their lockdowns have had to reimpose lockdowns. You've seen this experience elsewhere too. But we will try very hard not to have to go down that path, and we are able to do so because we now have an expanded toolkit of control measures. And that's what we've been building up over these past few months, right? An expanded toolkit that includes expanded testing capacity and the ability to take more targeted as well as swifter, faster actions, so that, as we've described, this way of going about our management of the infection, whenever we see a case, we quickly go in, we cast a wider net around that area, And we might very well have to do extensive sweeps or swab testing around that area. We might have to do an extensive quarantine around that area of the people who have been in contact, or we might even have to do a localized restriction measure for that particular area if there is a cluster in that area. So these are an expanded range of toolkits that we now have in place because we have built up the capacity over the past few months in terms of contact tracing, in terms of testing, in terms of the new operations that we are doing now. And hopefully with all of these measures, we can control the infection effectively without having to impose another nationwide circuit breaker.
Thank you, panelists. Can we have the next question from Siti from Kyodo News?
Hi, thank you very much. Yeah, I just have a question. So I noticed during the election walkabouts by the political parties to reach out to voters, there is close proximity and dense crowding in food centres as the candidates move from table to table, and which seem cannot be avoided due to Singapore's cramped and narrow spaces. So my question is, may I get your assessment? Do you see any risk or are you concerned of social gathering-induced infections arising in the community from this kind of scenario? And if I can ask about the Trace Together app, so far you have only distributed to seniors. So do you still have plan to get, to get this contact tracing app or token to be used in a wider community? Because so far it's only distributed among seniors. Thank you.
On the campaigning activities during this election period, the rules are very clear. The elections department has set out the guidelines very clearly, and they have deployed safe distancing ambassadors as well as enforcement officers on the ground to help manage these activities. So where the safe distancing ambassadors observe any lapses on the part of candidates, political parties, or even individual supporters who may be, gathered together, or for that matter, if I may add, members of the media, sometimes in their enthusiasm to try and get the best shots. Well, then the safe distancing ambassadors will highlight these and remind everyone that you have to take the necessary precautions. So we have seen some of these happen, and the safe distancing ambassadors are deployed on the ground to remind everyone and ensure that we are conducting this election in a safe manner for everyone. On the second question regarding the Trace Together token, yes, we've given out the first batch to seniors. We are looking at more to come in the pipeline, and as we get, number one, more supplies of these tokens in the coming weeks and months, and then number two, with the feedback from the first group of users, the seniors, then we can fine-tune our operations and deployment plan. So that's still work in progress.
Thank you. We only have time for the last two questions. The next question, can we get Philip from Bloomberg, please?
Hi, everybody. Good to see you. Perhaps you have noticed that at the ASEAN summit, a few countries have called for an ASEAN green lane. I wonder what you think, if you think that ASEAN is ready for such a thing at this point in time, and if you have any perhaps details about if those negotiations have started or when they might. Thank you.
It's certainly something that we would like to aspire towards, but the situation and the infection situation in ASEAN countries vary from country to country. So I think it's not something that can be achieved in the near term. For now, discussions are happening on a bilateral basis. For example, we've been discussing with Malaysia, and we are making progress in our discussions with Malaysia on a green lane arrangement or fast lane arrangements with them. And we are continuing to discuss with other countries in the region too. These discussions and will I think, conclude at different times. Some can be done faster, and some may take a bit more time because, as I said, the conditions vary from country to country. But over a period of time, I do think we should aspire towards such an arrangement, be it at the ASEAN level or even at a broader regional level, so that we can facilitate business travel in the first instance, essential travel as well, across the region in a safe manner. So it's a long-term goal which we would aspire towards, and we will continue to work with all the regional countries in the region towards that goal.
Maybe I should add that it's probably easier for us to work bilaterally as a starting point. And once we have established a couple of bilateral arrangements and put it in practice, iron out all the kinks, and maybe we will have some standard templates which other countries can then join in. And if you have enough countries that are joining into this common template, perhaps it can then be expanded into a regional kind of templates. And I think it will take some time, but I think we should not hold back bilateral arrangements instead of waiting just for the regional one. I think both can progress, but I think the bilateral ones probably will be easier, will progress faster and more easily.
Can we then have the last question from Kai from Channel 8?
Hello, as we resume the social visit in phase 2, so when we visit people's house, right, what's the guidelines in the house? Can we remove the mask? Because I think many of them forget about it. They just remove the mask and increase the risk of transmission.
Let me put it this way. It is very difficult for the government to enforce what goes on within your own household. So I think if you need to remove your mask, it's very difficult for us to impose and say you should not, otherwise I'm going to penalize you or send you a summon. But the key consideration is whether you need to protect your seniors. If you are in the household of the seniors, you can either keep your mask on if you are going to be very close to her or him, or you are going to administer him, take care of him, put a mask on because you are not sure whether you yourself are infected. But if you are just having a conversation in the living room, you have sufficient safe distance, you want to remove your mask so that your seniors can recognize you, you want to have face-to-face contact, I think that's fine too. But at the same time, even as you visit your seniors' homes, make sure you observe personal hygiene. Wash your hands, don't touch your face. If you are sick, if you have a sneeze and so on, please avoid visiting your seniors. I think do the commonsensical thing. The key focus is really to protect the seniors in your household, in your family. I think with that as a starting point, most people will know what to do, how to protect the seniors. Do the practical thing, and I'm sure we are not about to enter your house and to check on you and to audit you and to issue summons to you. Yeah, so I think just do the sensible thing with a focus of protecting the seniors in your family.
Can I just make an additional point that, as I mentioned just now, if you look at the community-linked cases and the patterns of transmission, we have had very few cases arising from social interactions so far. So that's the positive thing, right? We've opened up social activities, people can visit, but so far it seems like people are indeed taking precautions, and we've not had very many cases arising from these social interactions. We hope it stays that way, right? Because it's very easy when we are, with our family members, extended family members outside of our households or with friends, that we let our guard down. And when we let our guard down, whether it's over a meal, dinner, that's when that infection can go very quickly from one person to 10 people. Because, potentially if 5 people were to visit a household of 5, then you have 10 people at home. And now already people are saying, can we expand that limit of 5 to more, maybe 10, maybe 15? So the risk increases as you relax, right, potentially. And if we allow for more people together for social purposes later on, whether it's for a birthday party, for a celebration, then that risk potentially can happen. And it has happened before. In our context, we knew, and all of us remember, before circuit breaker, many of the cases that, many of the large clusters that we saw happen in social gatherings. That's why we are more cautious in opening up, but we are watching this very carefully, and we certainly want to encourage everyone to use the freedoms or the flexibility we have accorded now, where they can meet their friends and family members, do it responsibly, continue to take maximum precautions. Because if this number were to rise later on, right, we see more transmission happening among social activities, it will make it very hard for us to relax the rule later. We may even have to tighten this particular aspect of the rule. But if we see that continuously over the next few days, weeks, that indeed the pattern of transmission is kept low at the social setting, people are taking responsibility and taking precautions, and the overall infection situation remains stable and under control, then indeed there may be scope for us to progressively open up some more on the social side. So again, all of us must do our part in order for us to have a safe reopening of our economy as well as our society.